Hi, I'm Andy Acton.
And I'm Chris Strevens.
This is Dentology, the Business of Dentistry podcast. When you hear people that have a goal and they're goal orientated and they're determined, quite remarkable the change of direction.
Yeah, fascinating. You'll have to listen to learn about himself throwing himself out of a window, practicing on the way to
that's a teaser.
To go to dinner, isn't it?
That's clickbait there.
Told off for doing it 5 times in 1 week, so please listen for that. But just fascinating, as you say that, and yet another one that where there was adversity, and out of adversity comes where we are now.
It's and also, we always ask our guests the same 2 questions at the end about fly on the wall or who you'd like to meet. But when Pav told us who he'd like to meet and the connection as to why those people have hugely influenced his career.
As to where he is now.
Absolutely massive. And the story about the German hotel. Very funny.
If only, even if you skip forward to the end bit and think, really?
You must get to the German hotel bit, which is brilliant. No, it was really good conversation.
It was nice, guy.
If you're a new listener, you're very welcome. If you listened before, thank you very much. If you could subscribe, that'd be great. And if you'd like to share this episode or any others with somebody who you think would benefit from it, that'd be amazing.
Please do, yeah, fantastic.
So we're now upwards of 140 episodes, which is exciting.
It is scary, isn't it? 140, and they've all been brilliant. I obviously can't remember all for 140, but it's been a really good experience.
I think what's lovely is when we started this, we wanted to kind of create a body of work around the business of dentistry because we felt there was a hole there. And when you look back through the catalogue, the amount of topics we've covered off and the areas that we've got people to talk about has been quite remarkable.
It has. I was talking to someone the other day. In fact, they said that they liked the podcast because they felt it enabled our guests to talk about themselves. And they also said we are the Anton Deck of dental podcasts.
Really?
Yeah, and they also said it's quite interesting that anything they see, we always stand on the same sides. Like, you're always on my left, and I'm always on your right.
Well, to give people what they want, we should shut up and introduce our guests. Indeed, that's who they want to listen to. So today, we're delighted. We have Dr. Pav Khaira joining us, and Pav is a dentist. Specialist on the implant side of dentistry, which will be interesting, and also CEO of the Academy of Implant Excellence. Welcome, Pav. How are you?
Thank you very much. I'm very good, thank you. I'm looking forward to this. I've listened to some of your podcasts as well, and they're always entertaining.
Good. Well, we're very fortunate, and I think when you kind of go back through the episodes, I think we contribute about 7% of an overall episode. We don't actually have much work to do. We kind of just listen, which is the best part.
Yeah, it's brilliant. Yeah, wind you up and off you go.
Exactly.
See what happens. Yeah,
exactly. So we always tend to start because I think the thing that kind of draws people in are the stories about the people. The things we do are interesting, but it's always like, well, who is it? And we'll do it ourselves. If we hear about a new business or we're trying to find out about something, quite often we'll go to the About page and we'll look at Meet the Team, and we want to kind of say, well, who are the people in that business? So to give our listeners a sense of kind of who you are, often there's clues from our childhood in terms of it gives us a clue in terms of who we are today.
So if you could start at birth.
Yeah.
How's it gone since then?
So
my memory's pretty good, but it's not that good.
So if you go back, is there a time in your childhood that you can look back on and say, that's kind of a moment that led me to become the person I am today? Or what was your childhood like?
I was very blessed growing up. I had very, very loving parents. They were strict, but what Indian parents aren't strict on the end of the day. And even growing up, I was given an option really where my dad was like, you know what, you can become a doctor or a dentist, pick one. And this was from like the age of 8. He was like, be a doctor or a dentist, pick one. He was pushing me towards being a doctor. And so even I wouldn't say I was pushed in that direction, but I was definitely encouraged in that direction for a long time. I actually wanted to do medicine.
Oh, he's gone again.
And one of the issues that I had was I wanted to do medicine more for my dad than for myself.
Right.
And it actually got to a point where I did work experience in a hospital. Guys, it was the most boring thing. It was the most boring week of my life.
Really?
I've never seen anything more boring. I don't know whether it was a slow week or what, but I was on different departments, and it was very much a case of, we're not quite sure what's going on. Let's admit you for 24 hours. We're not quite sure what's going on. Let's admit you for 24 hours.
Okay.
The only exciting couple of days were
A&E. Go on.
when I was an A&E, and something happened which then embarrassed me to the point where I was like, I can't do medicine. I'm not going to do it, because I was so embarrassed from this. So what ended up happening is, partway through A&E, and I was about 14 at the time, 15, this guy had come in, and he'd had a huge laceration into his arm, like underneath his bicep, and it was bleeding very, very, very heavily. And the consultant said, "This is going to be good. Come with me and watch." And I was like, okay, cool.
Lots of blood. Come on, watch.
Lots of blood. I wasn't used to it. And I went in, and the consultant's like, okay, there's a bleed here. We need to try and figure out where it's going from. And he was like gowning up, putting on sterile gloves. And I was watching with intent, because at this time I was like, oh, this is fantastic. And I was okay until the point he took his gloved finger and put it underneath his bicep, and his finger disappeared. Mm-hmm. And what I remember is, like these twinkling lights and like this lightheaded feeling. And then the next thing that I remember is looking up and having 5 nurses looking down at me, holding my legs in the air because I'd passed out. And they were all in hysterics. And they said to me, how are you going to be a doctor when you can't even take this? And that was, for me, that was, at the age of 14, it was traumatic. And I was just, I can't do this. I can't do medicine. And then for a couple of years after that, I really wasn't too sure about what I wanted to do. Wow. And I did have this period for about 18 months. I was like, I'm going to be a stuntman. My mum was like, you're not going to be a stuntman.
A stuntman?
Yeah. I used to come home from school, go up the stairs, and then if mum called me to come downstairs, I'd jump out the window and come back in the back door. And it was just completely stupid stuff.
Really, somewhat random, Pav.
Very random. I was adamant. I was like, I want to be a stuntman. I was absolutely adamant about it.
It sounds like you were perhaps self-taught as well.
I thought you were going to say you'd go upstairs and your mum would say dinner, so you'd throw yourself down the stairs and do that rolly thing. Get on the bottom. Oh, I'm here, mum. But no, you just jumped out the window. Even worse.
I got told off once when I must have jumped out the window about 5 times within the space of about half an hour. Mum was like, "Pack it in. You're going to break your leg." So it's that was just a silly notion, really. But at the time, it was, when you're young, it's just like, this is what I want to do. But I think that phased out pretty quickly, and I ended up, between my A-level years, I ended up going to a dental practice to do work experience there. And it was fantastic because everything was hands-on, and that's when I decided this is what I wanted to do. Unfortunately, what had happened is I didn't do modular A-levels. It was like study for 2 years and do A-levels at the end. And I didn't do any work in the first year at all. My highest grade was a D- in the first year.
Excellent.
And I needed to be predicted 3 Bs to get into to get into dental school. Now it's just like, you need like 7 A stars at A-level to get into it. It's just insane. I don't think I could do it now. And I went to my teachers. I said, "Can you predict me 3 Bs?" And they literally just laughed at me. And I said, "Look, predict me 3 Bs." I said, I will graft. I will work this all this year. I will not let you down. And they ended up predicting me the 3 Bs, saying that if you let us down, they said, we'll kill you ourselves. And I ended up with an A and 3 Bs. And the A was in physics, and maths isn't my strong suit. So my physics teacher, she was really shocked. She was like, "How did you get an A at A-level physics?"
I think it shows determination, doesn't it, to be able to change your mindset.
If you've got a goal and something to focus on, how you shifted from being a D- student who was probably mucking about a bit and not
throwing yourself out windows,
to suddenly being able to really commit and change your whole course because it mattered so much to you.
Exactly. And you know what? I say this to a lot of people. I can predict people's implant careers by having a 20-minute conversation with them. And it all comes down to mindset. Because some people are like, I'm only an associate. I'm in a practice, my boss won't get me the instruments. I'm in a mixed practice. I'm in an NHS practice. I'm in this, it's a lot of money. And then you get other people who are like, my boss won't buy me it, so I'll buy the stuff myself.
Yeah.
I'm not in the right practice. I will hand in my notice. I will find a different practice, or I will upsell to my existing patients. I know it's expensive. I will sell my car and I'll do this, or I will. So actually, that mindset is really, really, really important. And that mindset will get you through tough times. So mindset is something that I've worked a lot on recently, and something that I'm a great believer on, that you have a focus and you work towards that focus, you can get very, very far.
We'll come to the implant side of your career shortly, but there's a step before that, which is obviously you got your 3 Bs. The teachers didn't need to kill you, which is good news.
And you gave up your stunt career.
Yeah.
Yes.
So you gave out jumping out of bedroom windows for dental school.
Yes.
And then graduating.
Before we ask him, can I just ask a quick question? Are you a bit like an adrenaline, don't worry about stuff, or were you more then, so like you would just throw yourself, and I don't just mean out of a window, but you would like go and be a bit thrill seeking?
At the time, yes, I was. Now I'm the complete opposite. I'm quite comfortable now. But at the time, I remember we had a getaway where like all the A-level students went away for a couple of days. It was just like an adventure weekend. And there was one bit where we're doing like I think it was a 75-foot abseil, like off the side of the thing, and everybody was having fun. And I was like, can I go forwards? And the guy's like, yeah, you can go forwards if you want. So I was the first to abseil forwards out of that group, and then everybody was doing it. Wow, and at the time, it was just, I always wanted to do something slightly different and just like push the envelope. Whereas now, heights, please don't. I don't know where this has come from. It's come after university, but I don't tolerate heights well at all. It's a full-on phobia now. But in a plane, I'm fine. But it's like even at the base of a skyscraper, looking up at it I feel like I'm going to pass out.
That's nuts, isn't it? When you could abseil forward, which those of you who maybe have abseiling forward is an interesting experience, and to go from that to then being nervous standing at the bottom of a skyscraper, it's fascinating, isn't it?
But then it's weird because kind of what you're describing, whilst that's kind of adrenaline junkie type stuff, it also says you're okay being outside your comfort zone.
Yes.
Which then when you then reverse that back into dentistry, the reason that you've kind of pushed on and done things and done new things and really kind of expose yourself in terms of what your capabilities, that's also being outside your comfort zone. So whilst it's a different, it's being played out in a different way, it's a similar approach. You're somebody who likes pushing boundaries, and as a kid, perhaps it was abseiling or doing those things, but professionally, you're still somebody who still likes to kind of see what the possibilities are in terms of where you can get to. So I think there is a thread in there in terms of how you are as a person.
And that's the other half of the mindset, right? If you've got the mindset to do something, the other thing that you need to do is you have to challenge your boundaries. You have to challenge your comfort zones, and you need to be smart about how you're doing it. Otherwise, you can quickly land yourself into hot water. But if you're not prepared to challenge those boundaries, what will happen is you will stay stagnant where you are, and you will never grow. And you'll look X number of years down the line, you look at your other colleagues who have pushed their boundaries, and they are doing things that you wish that you were doing. And the only reason why you're not doing it is because you haven't pushed your boundaries. Yeah.
So you graduated in 2002. Which dental school did you go to?
So are we going to get into the politics of this one?
Feel free to.
So I entered into UMDS, what was UMDS, which is United Medical and Dental Schools, in 1997. And that was Guy's and St. Thomas's. And in our second year, we, in inverted commas, merged with King's College London, and we became GKT. It wasn't a merger, it was a takeover. And
mergers don't exist.
Mergers don't exist. That's right. There's always one more dominant party.
There's always one powerhouse. Absolutely. And we were told that we would be the last. We because we entered UMDS, that we would be the last cohort to exit as UMDS. Our final certificates would say UMDS on it, and GKT was just kind of the umbrella under which that we were operating. Because we were already used to Guy's and St. Thomas's hospitals, we would stay at those campuses. Right. And what ended up happening is, in our final year, which is stressful enough, they decided to merge our year with the King's year.
Oh, wow.
And then we were told that we also had to go over to the Denmark Hill campus, that we had to learn all of their systems, all of their lecturers who had different treatment philosophies.
Oh, wow.
Yeah,
so when you go there and you turn around and say, this is, they turn around and say, what is your treatment plan for this patient? This is my diagnosis. This is my treatment plan. Oh, that's complete nonsense. So you have this level of anxiety getting to a new campus, learning how because even the computer system was completely different. Everything operated completely differently. In addition, gearing up to do your finals as well. And it was just, to be honest, it was a dumb move. It was a really stupid move on the part of the university. Yeah. And then when we graduated, we had a certificate that said King's College London on it. I actually failed my finals first time around.
I was going to ask, Pav, were there a number of people who weren't able to do the adjustments, so then had to do some research? Because that actually is a massive thing, isn't it? If you've learned most of your teaching in one way with a certain type of lecturers, and then in the last year to then go, oh, actually, now I'll tell you what, we're going to drive a manual car, not an automatic car.
Yeah. I think I was probably the worst at adapting because I refused to. I was like, no, I entered UMDS. I want to graduate UMDS. Whereas everybody else was just like, dude, it's not that serious. Just get on with it. I was like, no. I was like, UMDS to the core. To the point where our syllabus at the beginning of each year had the King's College London logo on the top of it. And I used to photocopy the old UMDS logo, cut it out and stick it over the King's College London. I was like, no, I'm passionate. I entered UMDS. I want to finish UMDS.
Have you got a tattoo or something?
No, I haven't. I didn't go that far. I was passionate about it, but not that passionate about it. And but even then, it's I still got on with it. But I because we had so many people in our year because they'd merged 2 years. There was probably about 7 or 8 of us who didn't pass our finals first time around.
Right. It's quite an impact.
I'm just laughing at you bothered to cut out a logo to stick on another bit of paper. That is like the ultimate, I'm really going to show how annoyed I am.
When I get
sorry, Pav, it just made me laugh. That was
when
brilliant.
I get obsessed about things, I get obsessed about things.
Oh,
I get
shit.
in my body, it has to be done. And what ended up happening is, you're absolutely right, is when you fail your finals after having studied for so long, it's not just the 5 years of university. You've been studying for GCSEs and for A-levels. You're talking best part of 10 years of your life, which is half of your lifetime. So that when people were turning around and saying to me, you know what, when you graduate, it's only another 3 months. It's not going to be that impactful for you. It doesn't register up here because you feel to yourself, half of my life's been wasted. Yeah, and I actually thought to myself, I can't be bothered doing this. And I went to speak to one of my consultants. And he turned around and said to me, he said, don't be a dick. He said, come on. He said, you made a silly mistake on your clinical exam. He said, you've passed all of your written exams, so you don't need to do any of those again. He said, this is going to be the easiest 3-4 months of your life. He said, you have to rock up 2 days a week to do clinical. He said, the rest of the time you don't have to. And he was right, and so I passed second time around. And now it doesn't mean anything. It doesn't. No. They were right that as time passes, it's just kind of like it becomes completely irrelevant.
In that moment, it feels like the world's closing in on you. Yeah. But we've done lots of these episodes, and we're always quite staggered at how many very high profile dentists who've gone on to have phenomenal careers. They stumbled. They stumbled. Fascinating. They didn't pass their finals, or they had to retake a year, or whatever it might be. And I find that quite nice because quite often people get to a stage in their career where all they see is what they're doing now. Yeah. They don't see the 20 years before because either that was pre-social media or people tend not to talk about things when the world's hard. But to hear stories where people say, I did fail my finals, or something did go wrong and there was some adversity and I had to build resilience and then I came back a bit stronger. All those things are really, really valuable because lots of the people who listen to this are students or younger dentists. And I think it's really important and powerful to realise that this is a career. It builds over time. It doesn't need to all happen within 6 months.
That people just see the success, don't they? They see the results now and go, it's like the old, what's that adage? There's no such thing as an overnight success.
Yeah.
There's takes time to get there.
It's funny, before we started recording today, I was talking to a friend and I was saying to him that thing around people overestimate what they can do in a week. that underestimate what they can do in 10 years.
Yes.
It's exactly that. It's like, in that moment when you failed your finals, it felt terrible. But now you're sitting here shrugging your shoulders saying, so what?
Yeah.
So what?
But it's the flip side of it. I mean, I'm open and honest about pretty much everything that that's all the bad stuff that's happened to me. And there's a reason for that. Is when you're on Facebook, when you are looking at other people's stuff, what they're doing is they're showing you the best of the best.
Yeah, definitely.
Right? I still make mistakes. There's a patient. I forgot to mention something to her. I forgot to mention risk of oral antral communication. I took out a couple of teeth, came out easily, and she ended up with an oral antral communication. You know what that is? That's being human, right? Yeah. I will make more mistakes throughout the rest of my career. Hopefully, they're only going to be small, easily salvageable with an apology. But it's the standards that we are held to professionally and that we hold ourselves to, quite often they're unobtainable. And this is why it's called practice. It's not called perfection. We don't work in a dental perfection clinic. We market it. Quite often people market it as a dental perfection clinic. Yeah. And then they're making a rod for their own back. It's over the years I've learned that, increasing your skills and learning to communicate with patients and just be human with them. Yeah. So all my patients call me Pav. I don't want to be called Dr. Khaira or anything along those lines, because I'm just one person with a certain skill set helping out another person. That's all that it is.
Yeah, it's nice.
Right? It's like if I was to get a plumber in to help me, they've got a skill set that I could never fathom.
No, that's right.
Yeah. And it's just all that it is you're helping another person out.
Always offer a cup of tea and some biscuits.
Exactly.
And so in my mind is being open and honest. I get a lot of other people who turn around and say, I'm glad you said that, because that's what I'm going through. It's nice to know that there's light at the end of the tunnel.
Yeah, that's good.
Well, it prevents also. Do you remember we went to the Global Dental Collective? Was it a couple of years ago? And they did this thing about the GDC. And I can remember Rajatan saying, basically, if you can build a relationship with your patients, then it will save you and prevent issues escalating because you've got that relationship. As you say, you're Pav, they're Dave, whatever it might be, but it means you can have a conversation about something as opposed to this almost perceived superiority. Yeah. I think you're dead right.
Which is really powerful. So you graduated from UMDS Kings, which was great. How did your career start as an associate? Did you move around much? What did you
change your certificate?
So early on, I ended up in a practice because I had a few months before I entered my what at the time was VT, what was called Dental Foundation now. So I had about 9 months as an assistant in that practice, and a year as a VT. Yeah, and I wasn't overly comfortable with my VT trainer because, it didn't teach me anything. In a year and a bit, I learned virtually zero. When I mean zero, you know how you're supposed to sit down and have like a 1 hour session every single week and stuff like that. And that never happened. Everything that I learned was from other people. He was pretty good at fixed ortho. So one of the reasons why I chose the practice, I was like, can you teach me fixed ortho? That never happened. I had like a half an hour session on fixed ortho, and that was stick brackets in the right position, and then everything else is easy. Yeah. And every time that I needed help, I ended up going to the other dentists, and it was an NHS mill. And by the end of it, I was disheartened, and I was like, you know what? I'm going to give it another year and see what happens. But in that year, I'm going to learn something new. And what I ended up doing is I ended up doing Chris Orr's cosmetic course. Which it was quite early in its days back then. I think I was about the second or third cohort, something like that. And that reignited my passion for dentistry because I was like, I'd had 18, 19 months of this, which was just patchwork stuff. And then I was like, okay, this is what you can do with dentistry. And then off the back of that, I ended up, so once I did Chris Orr's course, I then did Mike Wise's year-long restorative course.
Oh, okay. Yeah.
And I just ended up doing a number of courses. One of the reasons why I did a number of courses is in around 2006, I purchased a practice. I purchased my own practice. I was very young, had zero business skills. And I still think I was trying to do the right thing, but at the wrong time. So I bought it a couple of years before everything tanked.
Right.
And I was trying to do like this spa type experience.
Right.
So back then in 2006,
so that's before your time, really.
Yeah. And I was in Doncaster as well.
Right.
You know, if I'd have done it like on Harley Street in London or something like that, it might have
landed better.
Yeah, but you know, it's 2006, and you know, I love Doncaster. The patients there were lovely, but I was charging £800 for a crown back in 2006.
Wow,
you know, and it was just and because the business was failing, I was trying to learn new skills to add in another string to the bow, another method to generate income.
Yeah.
So what I was doing is I'd learned to do sedation. I'd learned to do acupuncture so I could deal with gag reflex patients. You know, I was doing denture courses. I was going over to the States to learn from Frank Spear. I was doing 6 Month Smiles courses. I was doing
too much, isn't it? You're just trying to do everything.
Yeah, and literally trying to do everything. Excuse me. And I couldn't get the practice to work, and I ended up losing it after just under 9 years. I think it was like 8.5 years, between 8.5 and 9 years. I ended up having to close the practice.
Wow.
I just started. I was early on in my implant career then. Yeah. And it was, to be honest, it was a big relief when the practice went, because I didn't enjoy it. It's not my skill set. HR is not my skill set. Numbers aren't my skill set. KPIs are not my skill set. You know,
what's great, Pav, hearing you say that is the self-awareness to admit that wasn't something that worked for you. Because I think the way that modern dentistry is, I think lots of people see that being a principal somehow is a higher level status than being an associate. Yeah. But that's like being a really good footballer and wanting to be a manager. You know, they are very different things. You can still be a phenomenal dentist and work as an associate or rove around delivering services. You do not have to own a business to still have an incredible career. And you're testament to that.
Yes.
And it's hard to be a practice owner.
It is.
You know, people perceive it as something really easy. And the answer is it's not easy.
This week's episode is brought to you in partnership with Ultimate Dental Business. We know as guys who have supported dentists for over 25 years and through hosting this podcast that building business skills in dentistry is vital. Time and again, we hear from dentists who tell us that they find the business side of dentistry the most challenging. And we know that stress and pressure comes from doing things we don't feel well equipped to do. That is why we are delighted to be part of Ultimate Dental Business, the new dental business hub delivering top-tier business training for dentists. Founded by Dr. Brad Thornton and Dr. Krupal Shah, Ultimate Dental Business is a response to the lack of robust dental business education currently available. Through our effective collective discussions with dentists, it was clear they most needed good structure and effective guidance to give them the knowledge and tools to be successful dental business owners, and to create a business that serves them rather than the business that takes all their time and energy to keep going. To find out more about developing your own business education, click on the link in the show notes or go to ultimatedentalbusiness.com.
And the most profitable practices are the ones which are associate led, which means that the principal isn't actually doing that much other than working on the business. So the principal is figuring out strategies, marketing strategies, B2B strategies to try to bring business in. They tend to do one or two of the high-end lucrative things like implants, but they tend not to do the general work. The general work is then given to the associates and it's given to therapists. So I think it's, you know, as you were saying, a lot of people assume, wow, isn't it easy earning money when you're a practice owner? It's like, you know, because when you're a practice owner, everybody else gets paid first and you get paid last.
Yeah. And also,
if you haven't generated enough, you take home less.
That's right. And dealing with people. I think that's the thing that people misunderstand, that actually dealing with people on an HR level is really, really quite hard.
Yeah, because you can't tell them to suck it up.
No, you can't. You can't say, "Oh, for goodness sake," because ultimately you can't. You've got to go down the. You know, it's a. I think it's a minefield because, and it's got worse and worse. I mean, we quite often see when our valuers do valuations, they end up with, you know, someone has got like 7 part-time staff or something. And you say, why have you got so many part-time staff? And he said, well, when they came back from maternity leave, they asked for part-time, so I have to give it to them. And we were saying, well, no, you don't have to give it to them. But because basically most dentists are really nice people who aren't business educated, they don't know. So you don't know what you don't know. But all you end up doing is creating yourself an issue. It's fascinating.
Yeah, absolutely.
So you now, in terms of, you describe, 5 or 6 or 7 different things that you were doing to try and make your practice work. But now you've really doubled down. You do prosthodontics, your implants, and I think your phrase is you're a self-confessed Titani-Nerd.
Titani-Nerd, yes.
Titani-Nerd. So that's your world. That's your world now.
Yeah, so I do. I place implants, and I'll do any prosthetics relating to implants. That's it. So, because of the training that I've had with Mike Wise, Chris Ward, and so many people, Frank Spear, and people like that, I was really quite comfortable even before I started placing implants to do full mouth rehab. I understand occlusion, complex stuff as well. So I do anything relating to implants and implant restorations. Cool. As a surgeon, I prefer just placing the implants and letting somebody else do the restoration. But if they mess it up, I then have to deal with it. Implant prosthetics and prosthodontics and occlusion is very different to that on teeth. Right, so I like to maintain control of it so that it's nice and predictable.
Get your take on, do you think that the dentistry 10, 12, 15 years out is going to move to a model where we'll have general practitioners who are doing maintenance care type work and then triaging out to people like you and other specialists? Because lots of markets are moved in that way, where you have a generalist that kind of offers a triage type service, and then you have this kind of pool of specialists. Is that the way it's going?
So just to clarify, I'm not a specialist because there's no speciality list for implants, but everything that I do is relating to implants. Just legally, I have to make that statement. What I think is going to happen, and I'll tell you the reason why this is happening as well, is general dentists will find something that they're quite happy and they're comfortable with. It might be surgery. It might be treating kids. It might be endo for some weird reason. It might be perio. And they'll gravitate towards that. And the reason for that is actually quite simple. It's because of the litigious society that we're actually in now, right? So which means that if I'm not comfortable doing endo, but I'm comfortable doing surgery, I'll just do less and less in the endo. So what happens is over a period of time, it'll be like, okay, I'm not going to do the molar endo. I'm just going to do premolars and anterior teeth. Then over a period of time, then it's just like, I won't do the molars or the premolars. I'll just do the anterior. Then it's just like, why should I bother doing any of these when I'm so busy doing the surgery? So I think what will happen is you will end up with practices where it's a generalist practice, but you've got a number of associates in there who are pretty damn good at doing one thing. They may not be specialists, but they are good at doing things. I think that's the way that is kind of like heading at the moment.
Sure.
I do think the biggest challenge that young dentists have now is when they graduate, they are woefully unprepared to enter the market in terms of their diagnostics, treatment planning skills, and their execution as well, because they don't get exposed to it. They don't get exposed to anything. No. I've been speaking to a number of experienced people who are like, we've got younger dentists in. It's just, it's easier for us to do the work.
Yeah, it's almost like you have to retrain them.
Teach them everything.
Yeah.
So what does this come back to? This comes back to what we were talking about earlier: mindset and determination. So these young dentists who are graduating now, they have to come out hell bent on, I am going to upskill, I am going to learn, I will do whatever it takes.
Yeah,
but that's not what happens.
Not just composite bonding.
Not just composite bonding. A lot of them come out and I'll do one course on composite bonding, and then I'll become a cosmetic dentist.
Yeah, that's right.
And we've got people like Govinda Berth and Andrew Chandrapal and Jason Smithson doing this wonderful cosmetic work. These guys have put 100 and 200K into their own education.
They've
honed their skills over. Sorry guys, I'm not. If you're listening, I'm not aging you, but you've got your skills over decades. So I'm saying, well, I'm not aging you, but I am. and people are coming out and they're like, okay, I want to go with them. It's like, okay,
yeah, they want to get to that level straight away, don't they?
It's like, okay, you can do that, you can enter that market, but understand who now your competition is. Whereas the better thing to do is to peel it back a little bit and just turn around and say, okay, this is what I want to do. I'm going to start learning the basics. I want to start learning them well. And I'm going to refine my skills. I'm going to do courses. I'm going to speak to my boss and, have some mentoring with him and then say, right, okay, can you send me a handful of cases just so I can start to do this? And, in order to build an avalanche, you have to start the snowball first.
Yes.
So if you want a skill set which is like an avalanche, is unstoppable, you have to start with that slow movement first. And you can't jump in straight at the top end.
Yeah. The funny thing that made me laugh there was the fact of endo again. Yeah. So endo, why would you want to do endo? It's fascinating. The number of dentists are like, endo, why would I do endo?
We should really get a specialist endodontist on who can balance the
enjoys
books,
it.
Out of people over the years who've gone, it's just not my thing. But there are people out there that love it.
It's funny, isn't it?
And I'll tell you when I started struggling with endo is because for a short period of time, I had a microscope in my practice. When I say short period of time, I had it for about 4 or 5 years. I was actually pretty good at endo, and then because the practice was failing, I had to sell the microscope to cover the cost of some other things. And all of a sudden, I couldn't see anymore, even with high-powered loops. I was used to times 15 magnification when you can see the apex of the root, and my confidence just dropped because I was like, I know what I'm leaving behind is not the best service for the patient, and that's when I went on the route that I'll still do the premolars and the anteriors. Then after a while, it's just like, you know what, I'll just send everything to my endodontist. My endodontist was superb, because you get some endodontists where patients got toothache and they're so busy, they're like, we can't get you in for 6 weeks. It's like, how can you leave a patient like that? The guy that I used to use, he'd deliberately have his diary structured so that he could get the patient in within 48 hours, but normally the next day.
Yeah, that's good.
And because he was so proficient at it, and again, he would do the entire treatment in a single visit. So the patient would go in toothache, come out with everything done, as opposed to 2 stages. Why was he proficient at it? Because he learned to do it. He committed. He was determined.
Yeah, that's right. Yeah. So he became a master.
Down to mindset and determination.
It is true. Very true.
What's your kind of clinical work pattern look like now then? So you work across a number of different practices now, or are you just based from one site?
So I work from about 3 different practices on a peripatetic basis, but I also spend a lot of time mentoring other dentists as well in the field of implantology. So I'm up and down the country, and sometimes that's, I'm Pav, I'm ready to start my full arch journey. Can we do some full arch cases together? Or sometimes it's like, Pav, I'm quite happy doing this, but this is crazy stuff. I don't want to do this. Can you come in and do it for me? And they're happy to assist. So I see quite a few patients where they need zygomatic implants, or they need subperiosteal frames, or something much more complex. And I have some people where they've done courses and like, okay, we're ready to be taught how to do that. We just need mentoring. And then I got delegates at the opposite end of the scale where they're just like, Pav, I'm early in my career starting implants. Can you help me build up proficiency? So we do that. Or whether it's, people want to learn sinus lift. So it's split between couple of days a week in my own clinics, couple of days a week traveling to help other people start and expand on their implant.
And this is under the Academy of Implant Excellence?
Yes, that's right.
You do this. So that sounds like it's not a particularly prescriptive program that says I do this. It sounds like it's more of a mentoring support program based on where the clinician's at the moment, and you then take them through a journey of improvement over a period of time.
So the theory is quite prescriptive. Okay, so the theory is delivered in basically 3 modules: essentials, advanced, and mastery. And the reason why I've made the theory aspects and the hands-on aspects separate is because some people are like, Pav, I just need the theory because I already place implants. I'm confident with my surgery. I can implement this stuff. And other people are like, Pav, I need the theory. I've got somebody who will mentor me already. And other people are like, Pav, I need the theory and the mentoring.
Right. So there's quite a lot of flexibility.
Yeah. So there's a lot of flexibility behind it. So by bundling theory and hands-on all together with no option, I was getting a lot of people. They're just like, Pav, I don't need the hands-on. I've got I've got delegates abroad where all they do is place implants. They just want to learn the really complex stuff,
Right,
And then I've got other people where they, as I said, they're like, oh, my principal places implants. He's good. He said he'd mentor me. Then all they need from me is the theory, really.
Right.
So that's the reason why I did it. And another reason why I did it is I'm really passionate about this stuff, and I'm a great believer in teaching in knowledge in depth. So not only how to do something, but why to do something. Because when you teach why to do something, it allows you, instead of being overly prescriptive with your treatment protocols. So your treatment protocols. So when you go on a course, it's like, this is the protocol. You get protocol A. You go on another course and you get protocol B. If you understand the biology and why these protocol works, you can take a bit of protocol A, bit of protocol B, and then do whatever you need to do. So you end up being more dynamic in your treatment planning. So in the middle of surgery, if shit hits the fan, you can just switch to another technique because you understand the biological principles. So I've always been passionate about, and this is what I get. You know what I get, because I teach a lot of. I run like a boot camp for people who want to start in doing implants. Right. They're like, the way that I teach it, they're like, I never knew that before. It's like, what suture material you're using, why are you using it, how do you hold the needle, what's the cross section of the needle like, what happens when you change the needle circumference, the needle design, how does that impact your
it's quite challenging thinking for some people, because quite often we just do things because we were told to do it by somebody who had more experience. Therefore we assume that is not necessarily the best way to do it, the only way to do it. We don't even question there might be another way of doing it. So something else that interests me, Pav, is that this stat might not be true, but it was many years ago. Germany's got a population of about 83 million. We've got a population of about 67 million-ish. So we're not a million miles apart. But in years gone by, in Germany, they always seem to deliver way more implants, like up to 10 times as many implants as the UK. Yeah. Do you know if that's kind of still the same? And why is it? Why does the UK lag behind in terms of implant volume?
Yes, it is still the same. And a big reason for that is the cost of everything out there. So I'm not just talking about cost of living, but cost of a lot of their labs, their components, and because they're on the continent, the cost of the implants and everything like that is actually quite a bit cheaper. I know one guy who places on average 6 implants a day.
6 a day.
6 a day. 5 days a week, six implants a day. €2,000 for a restored implant, and he can afford to do that because the lab costs out there, the implant costs out there, they're a little bit cheaper. But in addition to that as well, because he's placing so many implants, he's refined his skills so that he can very comfortably place 6 implants per day. You know. So if I wanted to, I could drop my fees and I could be doing 6 implants a day as well. But I don't want to. I'm at that point in my career where I'd rather see fewer people and do work to the level that I want to do. Because in order to do something like that as well, you have to be quite systematic in how you do it, which means that protocols have got to be fairly similar from one patient to the next with minimal variance. Whereas I will take each case on its individual merits and build a treatment plan according for that patient. But it's possible. I know people in the UK who did it. I've placed 6 implants in a day comfortably before. But again, it takes time to build up that skill set, which comes from the mindset and the determination.
Sure. Yeah. Listening to you talk today, you're so passionate about your dentistry and particularly implants, and you obviously lecture and mentor people. Yeah. So I was interested when we were sort of talking before we started recording about the other German story about when you checked into a hotel. I just find it amazing because you're sort of talking with such kind of confidence and authority. Just tell us your German hotel story.
Okay, fine. So there's a couple of things you need to know about me. One, I have a very driver type personality, so I'm very blunt and to the point. That's actually given me issues with my patients over the years because a lot of patients like a much softer approach. So I've had to work on my communication skills. But the other thing as well is I'm very much an introvert. I'm a real introvert. I know it doesn't come across it because of the way that I communicate, etc. But again, that's purely through training. If you turn around and said to me, Pav, every person on the planet's disappeared apart from your wife and your daughter, I'd be like, oh, cool. Isn't that amazing?
Mind you, we often say we think there's a lot of synthetic extroverts out there.
Yes.
We think most people aren't naturally as we are. We've conditioned ourselves to be as we are.
But my level of introvertedness is quite severe, and this is where it came out. So about a year ago, I was on a trip to see Meisinger, the factory in Germany, Neuss, and the hotel was booked kindly by Meisinger. And when I travelled from, I think it was from Heathrow, though. I went from Luton over to Dusseldorf. Then it's about half an hour in a taxi. So a lot of the guys, they tried to get on the same flight, but I just couldn't. So I actually took an earlier flight. And this is when it was just absolutely pelting it down with rain. And it was really bad when we got to Dusseldorf. And so I got there, got off the plane, got into the taxi, drove for what felt like best part of an hour, and pulled up to this. Best way to describe it was typical German architecture type hotel. And I think that the hotel was retrofitted into it. It was,
right.
like the hotel from The Shining. It was just big forever. It was just went on forever, and like very daunting, very like depressing type architecture.
Quite austere, yeah.
Yeah. And what ended up happening is I was messaging one of my good mates, also a severe introvert, and I said to him, "Look, I just got to the hotel." I said, "Wait till you see this place." I said, "It's like the hotel from The Shining." And I checked in, went upstairs to my to my bedroom, opened the door, looked around the room. There's no bed in the room. There was a meeting table in the middle.
Interesting.
And I looked around, and there's no shower, no ensuite or anything like that. I was just like, oh. And then I saw a door in the corner. I was like, okay, I thought it was one of these ones where you open the door, but that was locked into the next room. So I was given a bedroom with no bed in it. I was like, okay, so they've put us up in a hostel. The sofa bed pulls out. The sofa bed didn't pull out, and I was like, I can't. I was like, I just can't do this. Now, any normal person, any extrovert or anybody who's like not as severe as introvert as myself, they would go downstairs and they'd turn around and say, I think there's been a bit of a mistake.
Yeah.
Are you having a laugh?
In my room.
Yeah.
Would you mind checking me into a different room? Okay. My introvert brain kicked in. I was like, if I do that, I'm going to have to put up with apologies. They're going to turn around and say, are you sure? The manager might come out. There might be 2-3 people there apologizing to me. Well, all I want is a different room. So I messaged my mate, and I turned around and said to him, this is before I went back downstairs. I messaged my mate and I said to him, dude, there's no bed in the room. And he goes, what do you mean there's no bed in the room? I said, there's no bed in the bedroom. And he says, nah, you're joking. So I took a video of it and showed him and sent it to him on WhatsApp. And he goes, there's no bed in the room. I said, that's what I've just been saying.
So, I can identify a bed.
Yeah, I said, that's exactly.
Well, the thing is, the way hotels work, the clue is in the name. They rent to us bedrooms.
Yes,
the clue's there, isn't it?
Yes, yeah. So there was a group chat of everybody who was visiting as well, and I put it on there. I said, guys, I don't know what's going on. I said, there's no bed in the room, and everybody was like, this is ridiculous. I don't know what's going on. I said, I think they've accidentally booked us into a hostel. I said that there's no bed, there's no shower, there's no this, that, and the other. And I was just like, I don't want to be dealing with this. And everybody was like, no, that can't be right. That can't be right. And I messaged my travel agent. You notice I said messaged and not called, because when you're an introvert, you message and not call.
Yeah, okay.
And I said to her, Chris, I said, I've got a problem. I said, this is the hotel that I'm at. I said, there's no bedroom. I said, can you find me another hotel? And within 10 minutes, she was like, there's this one. Do you want me to book it for you? And she did. It was a Holiday Inn. It was about half a mile up the road. So I walked half a mile up the road in pouring rain, absolutely pouring rain, and checked back into this other hotel. because walking through rain and checking into a new hotel is more comfortable.
It's preferable
to having than having
and also, Pav, I hope you use your stuntman skills and climbed out the window to leave discreetly so no one saw you.
I was on the 4th floor, so no, not that time.
Wow,
that's incredible.
Yeah.
It's incredible. It's incredible that they put you in basically a meeting room instead of a bedroom. And also your solution to this was to leave quietly and check in.
You know what the worst thing is? Everybody arrived 2 hours later and sent me a video of a bed in their room.
Excellent.
Mine was the only one that didn't have a bed in it, and I was like, I'm happy here. I was like, this hotel's actually nicer. I said it's a half-hour walk to there. I said I can do that in the morning. So it's
a wonderful story.
Wow, brilliant.
Wonderful story.
That is excellent.
Pav, we always finish up in the same way. We ask our guests 2 questions. I think we're going to struggle to top that story, to be honest, but we'll go with it. We'll go with it anyway. So if you could be a fly on the wall in a situation, where would you like to be in and who'd be there?
The person who gave him that room. Let's have a laugh. Let's not put a bed in it.
Fly on the wall in any situation. I want to be a fly on the wall in the gym where Jake Paul is training to fight Mike Tyson, because I want to know exactly how afraid he actually is. Because either he's afraid of fighting Mike Tyson or he's delusional. It's one of the two.
Yeah, he should be afraid of him.
He's not genuinely confident. So I actually met Mike Tyson at a meet and greet a number of years ago.
Oh wow!
And I shook his hand, and it's like shaking a concrete glove. And this is, he hadn't trained for years. He's trained his physical body to a certain extent where it's just like, he's not going to forget this stuff. It's ingrained into him. When he trains, he's just going to get better and better. And I'd love to be on, because Jake Paul and all these influencers, they get on my nerves. And he's constantly going, I'm going to beat Mike. And I'd love to be a fly on the wall on his gym where his trainer's going to me, you really think you're going to beat Mike? And he's going to go, no, I'm really scared of
See if you can run around the ring long enough until Mike Tyson gets tired.
I saw some footage recently of Mike Tyson from when he was in his prime, but also today, and how he jumps and twists, which was kind of his sort of trademark move in terms of how people couldn't get round him, because he sort of jumped and twisted and suddenly he was in a different position. And he still does it today, and the speed at which he moves is just incredible.
I don't know if you've seen there's footage of him when he's about 16, 17 years old. His speed is just insane, absolutely insane. In terms of boxers, I think he's one of the best ever. And a big part of that is because he was a lot shorter than the average heavyweight. His was pure technique, and if you watch him boxing, is all the torque is coming from the hips, and he's got a low center of gravity. His defense was superb, and as I said, so here's the other issue as well, is I understand he's had somewhat of a controversial past. I'm not going to get into that because there's different thoughts on that. Some people like, well, he was stitched up, etc. Let's not get into that. There's a culture nowadays where it's like, oh, if you said something X number of years ago, that you have to be accountable for it today. It's this whole cancel culture thing. The issue is people change and people mature over time. Is if you speak to Mike now, is he sometimes he sounds like a broken person because he lost his daughter when she was 4 years old, and she managed to start the treadmill and she didn't know how to stop it, and there was an accident. Speaking to him now compared to where he was, and if you listen to like his true story, it's actually a quite heartbreaking story. He was found on the streets. I'm not saying he's a golden boy. I'm not saying he's perfect, but that's the nature of being human. Nobody's perfect. But I think the other thing that people need to understand as well is that when you do things and you make mistakes, it's okay. You need to learn from them and move forward. If you make a mistake, you learn from it, move forward, and you grow as a person. Don't hold people to things that they were like.
We're a soundbite culture, though, aren't we? That's
and also somebody like Mike Tyson, who's had to live out most of his life in the public eye. So we get to make mistakes and people don't see them. Only a few people might see them, and we get forgiven and we carry on. But when you're living out everything that you do is under scrutiny from the media. it must be so flipping hard, because sometimes people, we all have, errors of judgment, but they're mostly private.
Yeah.
Not so for them. So for them.
Yeah.
So my follow-up question,
Yes.
and you've already met him, so it might not be him, but if you could meet somebody and sit down with somebody and have a chat for an hour, a cup of coffee, glass of wine, whatever your choice is, who would you like to meet?
Dead or alive?
Dead or alive.
Yeah.
Fact or fiction?
Yeah, I'd want to sit down with both of my grandfathers again.
Oh wow!
Because
nice.
because one of my grandfathers, he was really proud of me when I was studying. He always wanted that for me. He passed away when I was quite young, so for him to see how hard I've studied, I think it'd be amazing for him.
Lovely.
My other grandfather, he's the reason why I got into implants, because he had a set of dentures he couldn't eat with. He asked me to help him, and I didn't have the skills to help him. That's what started me on my implant journey. That's why I was so passionate about implants.
Right.
And I want to say, and I never got to help him, but I want to be able to say to him that, look, I'm trying to help as many other people, and every time I help that person, it reminds me of you.
Oh, that's lovely.
That's lovely.
Those are the two people that I'd want to meet again.
Wonderful. Pav, it's been an absolute joy.
Yeah, fabulous.
It's been a whirlwind. It's been a whirlwind. We've covered so much ground. It's been absolutely fabulous. And I think you tell stories well. You are probably the best person I've ever come across who hides their introvertedness so well.
That's a skill in itself as well.
It's a talent. It's a talent.
It is. But no, I genuinely wish you well. I think you've obviously found a thing that really matters to you.
Floats your boat.
And doing it for yourself, but also helping other people achieve their success in the field that you're passionate about is cool.
Yeah.
He's going to throw himself off the chair now.
Exactly. Yeah, dive out the window and celebrate.
Down from the chair, yeah.
Bye. Oh, he's gone.
No, that's wonderful, Pav. Really appreciate your time
Cheers,
today.
Pav. Thanks for your time.
Cheers.
Cheers, man.
Dada. Thank you for listening to this episode of Dentology, where we discuss the business of dentistry. If you like what you heard, please do subscribe where you found this episode. That would be amazing. And also follow us on Instagram.